Thanks for staying with us. It's Tuesday, our Healthy Tuesday. So the celebration of the World Heart Day is on the 29th of September this year and is intended to increase public awareness of the cardiovascular diseases, including their prevention and their global impact. Joining us on the show to discuss more of this is the cardiologist, consultant, and at the National Orthopedic Hospital, Igbobi, Lagos, Dr. Okobi Sika. Welcome to the show, sir.
Thank you for having me.
We know the heart is one of the most important organs in the body, and we worry about so many other parts, but we don't talk about the heart too much. Just in a nutshell, just could remind us of the importance of the heart before we start talking about the possible issues it may have.
Okay, thank you so much. I remember that a few times I had a discussion with my colleagues. I used to tell them that the heart was the most important organ. So it is heart one, then every other thing follows, and then they would laugh. So truly, the heart is a very important organ because it is seen as the pumping machine of the body. Your brain, your kidneys, your muscles would not get oxygen or nutrient without the heart. So the heart just pumps the blood, carrying oxygen and nutrients to your tissues, and then your tissues can receive them and carry out their activities and grow. So the heart is a very important organ, and it is very unfortunate that a lot of people don't know what to do to preserve the function of the heart. So I see that this meeting and this gathering is a good opportunity to disseminate information so that we will know how to take care of our heart, yes, and to preserve it in its function.
So what are the best ways to take care of the heart? Some people say that walking is the only way. Some people have some other form of exercises. Okay,
well, there are quite a lot of things we can do to take care of our heart. So sometimes some basic lifestyle measures can be taken, like what you talked about, the exercise, and there are different modalities of exercise. So we generally, for cardiovascular health, encourage aerobic exercises, which can come in different forms. It could be brisk walk, could be swimming, jogging, skipping, even aerobic dances. So there are recommendations for what your exercise modality should be. WHO has stipulated what we should do. That to have adequate exercise, you should do about 4 times a week, minimum of 30 minutes each session. But for new starters, people who are just beginning, you should grow gradually. So maybe start off with 10 minutes, and over time, you can upgrade. But in your mind, you should know that the minimum is 30 minutes. Again, sometimes you might also be guided based on your premorbid state, the certain disease conditions that might be present in the patient. So healthcare professionals can help to direct or guide the patient or the individual on how to go about exercise. But generally, for a healthy Nigerian, aerobic exercise is minimum of 4 times a week. If you can do every day, why not? And then at least 30 minutes of exercise.
I wanted to ask, you know, when you're exercising, your heart rate goes up.
True.
So how high, and I know it depends on the age, how high, like I'm 63, how high can my heart rate go up? Can it go, if it goes up to like 60, 65, 165, is that very bad or is that okay? Oh. And how, recently someone, a famous singer died, Onyeka Nwenu. I believe that maybe because she had exerted her heart so much and maybe she wasn't used to exercise, her heart rate went up very high and then it didn't go down gradually. Maybe it should have...
That's your own assessment.
That's why I'm asking. I don't know, I'm asking.
Yeah. Okay.
You know, is it because sometimes they say don't exert yourself and then go down very,
So, very correct. Now, it is not just the heart rate. It is also, we also talk about the blood pressure. So these are the ways the body helps to coordinate activity. If I'm sleeping, my heart rate reduces because there are no serious activities. Not to say that there are no activities, the heart is still working, your muscles are, things are still going on, your respiratory tract though relaxes, but the functions still continue. But this is different from what happens when you are physically exerting yourself. So in a rest mode, your heart requirement is less. So what the heart is expected to do is less. But during physical exertion, climbing the stairs, running and exercising, then you expect that the tissues, the muscles are going to ask for more. And it is in the process to supply more that the heart beats faster. Now, the heart rate does increase when you exercise, but not just the heart rate, the blood pressure also increases. And I think the problem here is that sometimes people don't know their figure before they get involved in exercises. Okay, I was in a hospital some years ago, and a gentleman ran into the hospital and he said, "Doctor, check my heart, you know." And I perceived that he had had a terrible experience and he was afraid. And then I said, "Relax." So when he calmed down, I started the process. I did an echocardiography for him. And while I was doing the echo, I was astonished at my findings. His heart was big. His heart muscles were thickened. His chambers were dilated. And I'm like, "I'm sorry to ask you, sir, are you hypertensive?" And he says no. But it was very doubtful because the findings at that moment were strongly suggestive of, hypertension-related heart disease. So when I was done, I asked him to sit down when he was much relaxed. And then I checked his blood pressure. He was doing 160, 120. So apparently what happened was he was in a club with his friend, a very close friend. And while his friend was playing tennis, he slumped and died. So that put fear, and he ran to the hospital. So a lot of people don't know their figures. And I perceived that, in fact, I was just imagining that he could have died just like his friend. If he did not know at that time. So, and that's what happens to a lot of people. You see people, because high blood pressure, which today is considered the commonest cause of cardiovascular disease, and that's what we celebrate in the World Heart Day. Hypertension is the commonest cause of heart. It doesn't cause symptoms. It's just a silent disease condition. So people can have and run very high blood pressure without having symptoms. So you could be there with a 160, 120 before your exercise. So you now imagine what your blood pressure would be when you exercise, because your blood pressure can go as high. If you do a treadmill, and you are exercising, before a treadmill, they measure your blood pressure. So you could do like you might be at 130, 80. And minutes into the treadmill, they still measure your blood pressure. You see that some people are already doing like 180, 110. And this was someone who started with a 130, 80. So now imagine if your baseline was 160, 120, what your blood pressure would be. So, and that's the reason why a lot will just slump.
Going back to what YK said, because I was still trying to understand the answer to that question. Meaning that if somebody is running, and obviously your heart is pumping.
True.
Now, can you rest right after that? Can you rest immediately, or do you have to somewhat gradually go into rest? If not, because that could be what could cause people that slump and just die.
Okay, true. So everybody has a level of tolerance, and then the exercise, a lot of times when you exercise and you see that you are already getting worked up, the natural thing to do is to stop. So like we said, during those activities, your heart rate goes up, your blood pressure goes up. But within 30 to 45 minutes of exercise, when you are rested, your blood pressure and your pulse comes down. So it comes down. And that is why the recommendation is for those who have not been exercising, don't just start with 30 minutes. Go gradual. You can do like 20 minutes. You can do it like start off with 10 minutes, increase to 15, and gradually. You can even pick, some people can exercise for 1 hour, they are good. For those periods, their heart rates are high, the blood pressure is high, but the moment they rest, within 30 to 45 minutes, these
Back to
parameters back to normal.
So I know someone who...
Sorry, one second, Nima.
So how does cholesterol affect the heart? Because I noticed that as you go older, your cholesterol starts getting higher.
Okay, so the first thing about cholesterol is that cholesterol can be good and bad. And we need to also understand that the body makes cholesterol. Our liver synthesizes cholesterol, especially at night. But we also take some parts from our meals and our diets. So, and if you look at the different entities in a total cholesterol workup, what we call the lipid profile, you would see that you have an HDL, which is good cholesterol. So HDL is good cholesterol because if you have a high level of HDL, which is the high density lipoprotein, it protects your heart. It reduces the incidence of heart attack. And then we have the bad one, which is the LDL, low density lipoprotein. So that is the culprit for heart disease. And if you have excess of the LDL, so it gets deposited on the walls of the blood vessel, some changes occurs during the process, some cells within the vessels can engulf it, oxidation occurs, and then you have plaque deposited inside the walls of the blood vessel. So over time, the plaques increase and occlude the lumen of the blood vessels, and that can continue until such a time when there's a complete occlusion. So when there's an occlusion of the blood vessel, it means that blood will not flow. So the organ or the tissue that is supplied by that vessel will not get oxygen, will not get nutrient, and consequently, the tissue would die. So cholesterol causes heart disease when you have the high density lipoprotein getting deposited on a constant basis on the walls of the blood vessel, and over time, this narrows the lumen until there's a complete obstruction, and then blood supply, nutrient and oxygen completely cut off from the tissue.
Okay, is there a name for a condition where a person who wakes up in the morning wakes up with a high blood pressure and with activity normalizes his blood pressure during the day?
Okay, so a very good question too. So we have different types. We have some people who dip. When I say dip, their blood pressures are low in the morning. And we have some people who can spike in the morning. So they wake up in the morning with a very high blood pressure. And then as the day progresses, their blood pressure would drop. Now, unfortunately, we can only know what your blood pressure is at the time you come to hospital to measure. But truly, the better way to assess an individual's blood pressure, depending on what problem you perceive the patient has, is to do what we call a 24-hour blood pressure monitoring. So some patients can have a normal reading in the morning, and then in the evening, their blood pressure is going up. And then, but if you do a 24-hour blood pressure monitoring in which you wear the gadget and it measures your blood pressure for 24 hours, then it shows you the pattern. It tells you what your blood pressure, your highest blood pressure, your lowest blood pressure during the day, your highest, your lowest at night when you are sleeping, the average for the night and during the day, and the total day. So you can have a proper assessment. However, if you have a monitor, you could also take your readings in the morning and in the evening for those who have blood pressure issues. Yes.
I keep meaning to buy a monitor, Sif. I keep meaning to buy a monitor, but listening to you,
yes.
I'm very
motivated.
Yes, to make sure I get one.
How does breathing exercises help the heart?
Okay, so when you're taking a deep breath in inspiration, blood is pulled into the thorax, and then your parameters can, of course, when you're taking a deep breath and blood is pulled into the chest, then the blood within the circulation. The heart is connected to the lung. So the oxygen you take in diffuses into the bloodstream, and then that particular blood is diverted to the left side of the heart, and then eventually gets into the ventricle, which is, and the ventricle.
Breathing exercises are good.
So breathing exercises helps, because if you're taking a deep breath, you just drag in atmospheric oxygen into your lungs. So it means your lungs get ventilated, your blood gets more oxygen, and your tissues get better perfused.
You said something that worried me, that I thought, exercise would bring the blood pressure down. But you have now said it can increase your blood pressure.
Okay, so during exercise, your blood pressure goes up. After exercise, notice I said 30 to 45 minutes after exercise, your blood pressure comes down. So during any physical activity, so the normal response is that your pulse and your blood pressure would go up, because at that time, your tissues, your muscle, your heart, your intestines calls for more blood. And the only way that can happen is for your blood pressure, your pulse to go up, so they can supply your tissue. So when you run or jog, your blood pressure actually goes up. And that's why when people come to hospital, we say, if you have just climbed the stairs, don't just sit down for your measurements to be taken. Relax for like 10 minutes, because you have just undertaken an activity. So it will be good for you to rest a bit before you take your measurements. So it is during exercise that those parameters, your blood pressure, your pulse rise, but 30 to 45 minutes thereafter, they would come down.
So what's the best position to take your blood pressures, lying or sitting?
Okay, so in the lying, not bad. For those who are, for someone who is healthy and who wants to just check his blood pressure at home, it would be better in a sitting position with a table almost at the level of your chest, because the monitor has to be at the same level as the cuff, because the cuff is believed to be at the level of your heart. So not to put it on your thigh. So if your table is much lower than the chest wall, then that will not be a good position or posture.
It should be like this.
So, and that's why a lot of people like to check on the dining, because a lot of times the dining table is almost at the level of your heart.
Let me take this call from Daniel. Good morning, Daniel. Thanks for calling.
Yeah, good morning, madam.
Good morning.
Please, I have a question for the doctor in the house.
Yes.
Yeah, he's talking about the monitoring of blood pressure for 24 hours. I want to know what is the interval we'll be checking it. Is it every 10 minutes, 20 minutes, or 30 minutes? That's my question.
All right. Thank you very much, Daniel. Intervals to be checking your BP.
Okay, so during the blood pressure monitor, it's the machine that checks for you. It's an electronic device which you wear on your arm. So during the day, the machine measures the blood pressure every 20 minutes. And at night, the machine takes the reading every 30 minutes.
That's in the hospital. He's talking about the manual one at home.
Okay, you mean the manual one?
It means that mobile ECG. What he thinks is that the manual one, how do you check?
Yeah, that's
For you, what you're talking about is the machine they wear on you for 24 hours.
Yes, so you wear the machine for the 24-hour blood pressure monitoring. Is different from what you use in the hospital.
Yes, that's what he's saying.
So the one at home, you don't need to be measuring. You can't use the one at home and measure for 24 hours. I mean, it will be impossible. So, and that's why there's a special device for a 24-hour blood pressure monitor. You wear it and you go about your normal activity. You go to work, you eat, you cook. It doesn't stop you from doing your activity.
So
So you can have that one, you can buy that one.
No. Well, some people have the gadget, but I mean, a lot of people can't use it because it prints out your reading, and then an expert needs to interpret for you.
The question I thought the guy was asking, the manual blood pressure machine that we have,
yes,
how often do I check? Is it morning, afternoon, night? Is it every day, 2 hours, every 1 hour?
So you really don't need to check your blood pressure so often, because again, there's a lot of anxiety associated for some people if they have to monitor their blood pressure so many times. However, sometimes a doctor may ask a patient to monitor a bit frequently for when I adjust my patient's medication and I want to see the impact of medication. I may ask my patients to check every day and send the readings to me.
Okay.
And then once I have established, I've seen what I want to see, then I can say just check 2 times a week or once a week. So everything depends on who you are dealing with and the disease process in question. So for some people, once a week is fine. Yeah. For some people, 2 times or 3 times a week is fine. You don't really have to check your blood pressure every day. And if you want to do so, there's nothing wrong if you think you have the time.
Let me take Kelechi. Thanks for calling, Kelechi. You're live.
Yeah, Mariah, I want to ask the doctor a question. Can you hear me?
Hello,
can you hear me?
Yes, now I can hear you.
Okay. Please, doctor, I want to ask you this question. You know, in gym, we see gym instructors as experts. Some of them don't have medical knowledge as to how to regulate our system, how to guide us medically. But unfortunately, a friend of mine, a gym instructor went to, train his brother in a... Hello? Hello?
Go ahead, Kelechi.
Okay. Yeah, let me start all over again. I said, a friend of mine, I said, we see every gym instructor as an expert. But unfortunately, some of them don't have the requisite medical knowledge to guide some of their clients. One of my friends, a gym instructor, went to train his uncle in his house. As during the exercise, his uncle slumped. He almost died. So when they got to the hospital, the doctor discovered that the gym instructor was guiding him as against his medical programming. So, doctor, I want to ask you, as a professional, what do you suggest in this kind of scenario, this kind of case? Thank you very much.
Well, I don't know how to do that. So the gym instructor obviously is not trained. So
yes, exactly. So a lot of people who participate in exercises in the gym have instructors. Some of those instructors have some little knowledge, so they can guide. But the knowledge they have is like acquired from, limited. So I think what he's saying is, he was saying that his uncle saw a gym instructor who was doing activity, he slumped and he almost died. The whole essence of this is we try to empower every individual with knowledge to know your figure and to know what you are supposed to do. My heart patients, they know the kind of exercise they are supposed to undertake, and they know that when it starts getting to this, you are going beyond the limit, and they would not go with you. So it may not necessarily be the instruction from the gym instructor that was the problem. It might just be that his uncle already had some background medical problem, which he was not aware of.
Okay, let me take a call. Thanks for calling. Hassan, you're live from Lekki.
Good morning.
Good morning, sir.
Good morning. Doctor, please, I have a question for you. In a lot of instances, we find ourselves in a situation whereby doctors will always advise you to exercise. And now, based on what I'm hearing from you, your exercise must come with instruction from the doctor again. And the doctors have been telling us, anytime you go to a facility, they will tell you, because hypertension is a common disease. A lot of people are suffering from it. But the doctor will always tell you, for you to protect yourself from diabetes and whatsoever, you should engage in physical exercise. And now we are now seeing the adverse effect of exercise. And not everybody will go to a doctor to ask him whether to embark on an exercise or not to embark on my medical conditions. That is one thing. And secondly, my question is this. Please, this nifedipine nifedipine for controlling hypertension. Please, what is the side effect of it?
All right, thank you very much, Hassan.
Okay, so I think I need you to understand me. There's nothing wrong with exercise. We are just trying to say that you need to know how to go about it. Exercise is one of the non-drug method of controlling blood pressure and even helping your sugar, your blood glucose control. Exercise is one of the non-drug, because you have, for treating hypertension and diabetes, you have the drug method and measures, and then you have the non-drug. So for the non-drug measure, exercise is one of them. But what we are just trying to say is that some people engage in exercises without knowing their figures. I mean, it is wrong for you to have a 200, 120, and you are going to do high intensity exercise. It could be dangerous because during exercise, your blood pressure goes up. So if your baseline is already 200, 120, so you can imagine that you might get to 280, 150. And at such levels, your blood vessel may not be able to withstand it. You can have a blood vessel rupture.
So know your numbers before you start.
So you know your number before you, exactly.
That's
so that's what we are
crucial.
trying to say.
Fantastic.
So if you see that your blood pressure is quite high, it might be better to start off some medication, get your blood pressure a bit down, then before you can now engage in exercise. But for those who are fine, who don't have blood pressure issues, you are sure you've monitored, you've checked. I mean, there's nothing wrong with just getting involved in exercise. And then he said the side effect of nifedipine. So nifedipine is one of the medications we use for treating blood pressure, and it belongs to the family of drugs called the calcium channel blockers. So this group of drugs characteristically cause swollen feet. So, and then they cause headaches, and then they could also give palpitation. Palpitation means increasing your heart rate. But again, you know that there are very common side effects for all drugs. Some drugs have very common side effects, and rare side effects. But what I'm mentioning to you now are some of the common side effects of nifedipine: headaches, swollen feet, palpitations. What else? Well, those are the common side effects you can have associated.
Let me take this call from Bagada. I know that a lot of callers who are trying to call in right now. Good morning, calling from Bagada. You're live.
Yes. Good morning.
Morning, sir.
My name is Obed, calling from Bagada.
Ruben.
Obed, yes.
Obed, go ahead.
Calling from Bagada, yes. Please, I would like to ask the doctor. My wife is a BP patient, and during the night, her BP goes up for no reason. Meanwhile, she's taking her medication. And sometimes when it goes up like that, goes too high, she has to take a nifedipine under her tongue to bring it down, and also with the other medications. Although she takes just two medications, metidopa and nifedipine. Nifedipine comes when the BP is high. Well, I don't know what causes it. During the day, her BP is normal. But during night, while she tries to sleep or when she's sleeping, most times it goes up just like that. So what could be the cause, please?
So this still brings me to what I talked about before, that different people have different patterns of blood pressure. There are some people, you know, generally people think that in the night when you are resting, why should your blood pressure go up when you are resting? And that's why we say it has nothing to do with rest, as it were. You can be resting and your blood pressure will still go up. So it depends on your pattern. So I perceive that your wife spikes at night, and when we have such pattern, there's a way your doctor has to adjust the medications. Some people may have to take some medications at night so that on waking up in the morning they have good blood pressure readings. Some may have to take most of their medications in the morning. Some may have to take something in the evening. So everything depends on the pattern. But it is something that your doctor, your wife's doctor, needs to work out. But it again shows that her medication needs to be adjusted. Her medication needs to be...
Okay, yeah, so this, I have a friend, she's over 50. And recently, they just realized that she has a hole in her heart. Usually, I hear it with infants. Mostly, they will have a hole in their heart, and most times, they don't even make it. But I'm now wondering, somebody that is over 55, with a hole in the heart, did it just happen, or she's had it a long time, and...
What could have caused it?
Exactly.
What could have caused? Thank you. So thank you for your questions. So a hole in the heart is usually congenital. So congenital means the child was born with it. But when the hole is small, it may not cause symptoms until adulthood. And on physical examination, sometimes when the hole is small, a very careful doctor might hear some sound in the chest during physical examination with stethoscope that may point to the fact that there might be a hole in the heart. So the doctor may not be sure, but from the sounds you hear with your stethoscope, you may pursue it and ask the patient to do further investigations, echocardiography. Now, a few people can develop a hole in the heart in adulthood. It's not common. And these are people who have had a heart attack. So there are some types of heart attack that may affect the muscle that separates the two chambers in the heart. We call it the interventricular septum. And because a heart attack means that the muscle dies, then eventually a hole can develop subsequently. So it could be a development that occurs in adulthood, not common, but heart attack is one of the major things that can make someone who did not have a hole in the heart in childhood to eventually have one.
Okay,
but generally, it's congenital.
I'll come to you, Nima, in a second. I have Olawale from Satellite Town. Thanks, Olawale, you're live.
Yeah, good morning, Auntie Moraya. Welcome, ma'am. Yeah, hello, doctor, can you hear me, sir?
Yes, I can, sir.
Yeah, please, my question is that on this year in March, I'm a SCI patient, right? I think you understand what I mean by that.
BI? I can't hear you.
Yeah, I say I'm a SCI patient. I mean, so in March this year, I went for physiotherapy. Immediately I reached the hospital, I was directed to check my BP. So when they checked my BP, they couldn't attend to me for the physiotherapy I went for. They now called the doctor. So they admitted me too on the admission. So what they discovered is that I have a low BP, which I'm the one that will myself to the hospital. So my question is that, is it possible for someone that will himself from house to the hospital? Yes, and they said he have a low BP. And last week again, the same thing happened to me. I went for the physiotherapy again. They still said I have a low BP, which they admitted me, and I spent more than a week before they discharged me. This was the cause, and I don't really know why I always have that. Which people that have the same challenge with me, they do have a high.
Okay. You're getting a lot of patients on TV today, but go ahead.
So I understand. So, well, it is not common to have low blood pressure, but truly, yes, you can have low blood pressure. That's one. Then two, I feel that the problem with low blood pressure is that sometimes the diagnosis for low blood pressure is wrong. So I have had people referred to me for low blood pressure because their blood pressures were 100/60. And I'm like, your blood pressure is normal. 100/60 is not low. I've seen people who were sent to me because their blood pressures were 110/60. So, and these are normal readings. So when you say your blood pressure is low, it means that the upper one, which is called the systolic blood pressure, is below 90. And the lower one, which is called the diastolic blood pressure, is below 60. So even a 90/60 is a normal blood pressure. But if you have an 80/50, then that is low blood pressure. So if your blood pressure range for those times you had to be kept back in hospital was in this range, then we could say that your blood pressure was low. The commonest cause of low blood pressure is high blood pressure medication. So many times, people come down with low blood pressure because the doctor is trying to optimize the patient's blood pressure. So the patient is already on some medication, blood pressure is not controlled, and doctor is increasing the dose. So if you increase the dose too aggressively or too often, then the patient's blood pressure could drop. Then there are other little things that can make your blood pressure to be low. Like if you had massive, diarrhea illness, vomiting episodes, those things, or blood loss, you bled. These things are common things that could drop your blood pressure.
Okay.
Yeah, okay.
And then finally, a disease condition that is not common. In my how many years of medical practice, I've only seen 2 cases that is commonly associated with low blood pressure. Is Addison's disease. It's an endocrine condition that has to do with low cortisol level. It can cause low blood
pressure. Very short time. Let me let
Yes.
Nima jump in. He's been waiting for a while.
Okay,
Go ahead.
so I wanted to ask about low hemoglobin. We had this episode where we were doing blood donations,
Okay.
and I was said to have low hemoglobin. And so, can you explain what it is?
Okay. So hemoglobin is a parameter that assesses your blood level. So your blood level can be in grams or in percentage. When it's in percentage, we use packed cell volume, which is PCV. And then when it is in grams, we use hemoglobin. So as an adult female, you are expected to be within the acceptable range for normal, which is like 12 to 16 for females. So if your own is below 12, then they will say your hemoglobin level is low. And that is to say in a layman's language that your blood level is low, which is different from blood pressure. So if your blood level is low, then you want to try to find out. The commonest cause of low blood level is iron deficiency.
We have comments.
Asking me, Moses Ade is asking me to ask you what causes night sweating.
Night sweating. And let me also add this question because our final time. It says I've done an ECG with 24-hour Holter monitor and they've all come out clean. I get palpitations and sometimes chest pain. They don't last very long and they happen randomly. So I don't have any specific triggers. So what kind of test can you undergo? So night sweating and then this person is having palpitations.
Okay, so for night sweat, a lot of things can cause night sweat, but let's just pick the
Another
common
person
things.
answered him that it is it's village people.
Okay, now, so on a more serious note. Okay, well, tuberculosis is one of the conditions that is known to present with night sweats. So if you hear that someone has a drenching night sweat and the person has been coughing, losing weight, runs a fever at night, then what should strike you is tuberculosis. Then there are some cardiac conditions that can present with night sweats, like people who have heart failure. So those who have heart failure, because of certain chemicals that are elaborated or secreted into the bloodstream, tumor necrotic factor, interleukin-6, patients with heart failure can sweat a lot, especially at night.
Okay. All right, because of time. The ECG person says that I've done ECG 24, Holter monitor, they've come out clean, but they still get palpitations sometimes.
Okay, so palpitation is a very big issue. And then the way I solve palpitation is I try to classify what kind of palpitation the patient has. So we have what we call the symptomatic palpitation and the asymptomatic palpitation. So symptomatic palpitation means the patient's palpitation is dangerous and must be treated. And this means when you have palpitations associated with fainting spell. Palpitation means awareness of heartbeats. So when my heart is beating, but I'm not hearing it, I'm not feeling it. That is the way it should be. But when you become aware of your heartbeat or you feel your heart is beating fast, then you say you have palpitation. So if you have symptomatic palpitation, it means you have, with your palpitation, there is a fainting spell. So while your heart is beating, you could pass out. Or while your heart is beating, you develop a chest pain. Or while your heart is beating, you become breathless. Or you start sweating profusely. So if you have palpitations with these symptoms, then we'll say it's symptomatic palpitation, and it means it has to be treated. Okay.
Unfortunately, we ran out of time. Maybe I'll tell the person.
Please, can you come back
Thank you. We need to bring you back. Maybe we should have a series on hearts. It's like lots of Nigerians have a lot of questions, so we might have to bring you back to continue this conversation. Thank you so much, Doctor, for coming.
Thank you so much, ma. Thank you.
That's all we can take on today's show. Have a great day. We'll see you tomorrow. Bye for now.